My name is Dr. Janelle Veenstra, and I'm here at the Women's Specialty Care Clinic in Holland Hospital. Anxiety is a really big issue that often goes overlooked or sometimes just kind of dealt with in a lot of women. You have different stages of life that women transition to, different societal pressures, different hats that we wear in the community, whether it's roles in our family, church, job. And so managing anxiety is extremely important and often normalizing that it is okay to not be okay sometimes. When it comes to anxiety, I look at the thinking process. What is the internal dialogue a person goes through when they have anxious thoughts? The persistence of worry, the physical and physiological manifestations of anxiety, such as sweaty palms, or sometimes restlessness, or difficulty sleeping, all the way to just nervous tics or just nervous habits that we've used to cope. Those are not all of the signs or symptoms. That is just an example of how anxiety can manifest itself, because sometimes we look for the obvious symptoms, but it can be very subtle. And it might take a family member to even point it out that we're not acting like we usually do, or that something's off. It's really important to understand the signs and symptoms of anxiety, and then also be willing to ask for help and to see a provider such as myself or anyone else here in the clinic to provide coping methods and walk you through different ways to manage anxiety. And notice I say manage, we're not looking to get rid of anxiety. We want to understand it has a purpose, but we ultimately want to manage it in a way that is constructive for one's life. Anxiety is prevalent among many people, whether you're a grandmother watching your grandchild, or a new mother dealing with a 7-month-old, or you are a high schooler that just graduated. Anxiety manifests itself in many ways, and we all can use help with that. If you have questions on anxiety and you'd like to talk to me more, you are more than welcome to call the Women's Specialty Care Clinic, and I'll be more than happy to talk with you.